Howdy guys, Dr. Sean here. So if we met in the hospital, um, I probably asked you a question to get at your chief complaint. I probably asked, so what was the main thing that brought you to the hospital? In your own words, what happened? And so I was asking about the chief complaint primarily to get at what part of the nervous system is involved and how the nervous system was involved. Now after an examination, what we usually do recommend is a test or a series of tests. Okay, so I just wanted to talk about some of the tests that we order and what they are for. Now the first test that we order is many times a CAT scan of the brain, particularly if you had a headache, or if you had abrupt weakness, abrupt vision change, some abrupt neurological sign. What we're looking for is a CAT scan, and primarily to rule out blood. Blood will show up quickly on a CAT scan, acute blood that happened over the past day or 24 hours or even last week. Now, after we've ruled out, let's say, an artery breaking and thereby blood in the brain or affecting the spinal cord, what we're looking to do then is to evaluate for a blockage of a vessel. And so not a bleeding stroke, but a stroke that's due to artery blockage. The best test for that, particularly if it happened over the past day or so or even a couple of hours, is an MRI of the brain. And so that's why we would order an MRI of the brain, because it can quickly and very specifically rule out an artery blockage type of stroke, an ischemic stroke, you might hear somebody say. Now, aside from looking at the actual brain, if we're talking about artery issues, many times what we are looking to do is to look at the arteries by MRI. So that's called an MRA. We can look at the MRA and MRI of the arteries of the brain, as well as an MRI of the arteries and MRA of the neck. So you might hear us say an MRI or just MRA of the arteries going into the brain, so the neck, or an MRI of the arteries in the brain, so an MRA of the brain. And we usually don't have to add contrast for those. We can do the same types of studies looking at the vessels by CAT scan, so we may refer to those as a CTA, a CAT scan of the arteries. We can do a CTA and look at the arteries in the brain, as well as a CTA of the arteries in the neck. So that's frequently what we do. Many times we don't have to do both of those, a CTA and MRA. Only under certain circumstances, like if we need confirmation. Now, ultrasounds we can do of the arteries, but they take longer. And they're less definite also. So we're not looking directly, but indirectly, and we're looking by way of how the blood flow sounds, really, ultrasound, coming through the vessels. We're not listening, but we're using technical equipment for that, an ultrasound machine. So those are different ways of imaging: ultrasound, CT, and MR. Many times we can look by way of the electricity coming through the nervous system. So an EEG to evaluate for seizures, an EEG, an electroencephalogram, or even an EMG, the electrical activity that's coming through the nerves as well as the muscles involved, and the connections between the nerves and the muscles, neuromuscular junction. So an EMG and nerve conduction studies can help us to evaluate for neuromuscular issues like myasthenia gravis or GBS, Guillain-Barré syndrome. Okay, ultrasounds can help us to evaluate artery blockage, as well as direct imaging of the vessels, as we spoke of earlier. And those are some of the most common tests. Now, sometimes we end up needing a biopsy, like to take a piece of the tissue, like a lumbar puncture, a small needle through the small of the back, right between the vertebra, right between the bones of the lumbar spine, and then we would let some of that cerebral spinal fluid drip into tubes and send that off to the lab to evaluate for blood, like if a person has a bleeding stroke, a subarachnoid hemorrhage. And then sometimes we can do a lumbar puncture to evaluate for infection, like meningitis or encephalitis. So those are the tests, and then some of the indications, some of the reasons why we might order those tests above that you see. So the first is, and this is the standard everywhere, particularly in our country, is a chief complaint to understand what part of the brain or neuroaxis is involved, and then and how is it involved, and then an examination. After this part of your evaluation, the history and the evaluation, like actually examining you, we order these tests above, and then we come up with an assessment, basically an idea of what we think is going on, and then we come up with recommendations for moving forward. Okay, guys, take care. Hope this has been informative.